So far, the H1N1 flu virus has contributed to more than 600,000 deaths across the U.S.
I think it's 600 deaths.
Oh, I'm sorry, 600.
600 deaths. Just yesterday, the FDA finally gave the green light for a vaccine. Dr. Nasia Safdar is an epidemiologist and infectious disease physician at UW Hospital and Clinics, and she is leading the hospital and clinics H1N1 preparations. Welcome to you. Thanks for being here. And also, News 3's gadget guy, Steve Van Dinter, is going to join us once again by Skype. He was diagnosed with H1N1 on Monday. Hi, Steve. Thanks for joining us again
Hello,
today.
no problem.
Dr. Safdar, let's begin with you and tell us what the main message is that you want to get out to people who are watching this.
I think the main things we want to say is that the transmission of H1N1 is very similar to that of seasonal influenza. So the common sense things that we all too often take for granted, which includes things like attention to hand hygiene, covering your cough, making sure you use a tissue rather than your hands, or if you don't have a tissue, then use your sleeve instead, and staying away from people that are sick. We're also asking people, especially healthcare workers, that if they get sick at work or they're sick at home, to not come into work and to immediately go home if they get sick at work.
I'm assuming this is water cooler talk everywhere, at jobs everywhere. I mean, when people talk about the seasonal flu and H1N1, what is the bigger threat between the two?
I would say because of the greater transmissibility of H1N1 and because the population is in general naive to it. We haven't seen this before, so we're not immune to it. So H1N1 is a bigger threat. But we have a vaccine for seasonal influenza, and therefore we're urging everyone to take that so that at least we can get that out of the picture. And then when the vaccine for H1N1 becomes available, we'll also recommend that.
Well, it's sort of the virus versus the vaccine right now.
That's
Will the
correct.
vaccine be available in time before swine flu really takes off?
Well, I think we were all a little bit surprised that it started sweeping campuses, particularly colleges and universities, so quickly after classes resumed. So I think it's definitely here. But I still think that the vaccine would be extremely valuable when it does come out.
And Dr. Safdar, we've heard the word pandemic. First of all, tell us exactly what it is, and can this be a pandemic?
So a pandemic is defined as worldwide spread of an infectious disease. And so this really is a pandemic. It's been reported in so many countries around the world. It's clearly a worldwide virus. And the WHO classifies it as grade 6, which is defined more by its transmissibility and the places where it's been seen rather than by severity. So grade 6 is the highest that they can go, and that essentially means it's everywhere.
So how concerned are you personally about this? Is this something, do you think the media attention to this has been appropriate, or do you think maybe we're blowing it out of proportion in some ways?
No, I don't think we're blowing it out of proportion. I think that we can't say too many times to people that we still need to use the traditional things that we know will help prevent the transmission of infection. And so the more often we get the message out, I think the better it gets. We are concerned about H1N1 because since we haven't seen it before, the vast majority of people are not immune to it. And we're seeing it cause disease in healthy individuals who are people that have no other conditions but yet require hospitalization, and some have died from it. So it is of concern to everyone, I think, and should be.
And joining us is someone who was a perfectly healthy individual, Steve Van Dinter, gadget guy. Thank you for muscling through this, Steve. Tell us, how are you doing right now?
You know, today I feel great. I woke up, my fever's gone. I've got a 97.9 temperature, which is fairly normal for me. I feel better, you know, probably at about 75–80%, I would say. I still got a little bit of a cough, but other than that, I'm actually feeling great. So I understand that I probably should stay home a little bit longer. Some say that the cough might still be contagious. So I've been keeping my distance from people still, but I've emerged from my room now and actually made it downstairs into the living room. I've been having snacks. I've been interacting a little bit more with the rest of the house. So I feel a little bit more alive today.
Well, that's good. So you're turning the corner. And Dr. Nestor, what is the general recommendation about how long you should isolate yourself if you have this?
You should isolate yourself for about 24 hours after fever has gone away and you're feeling better.
And then you're no longer contagious at that point?
That's correct for the general public. For healthcare workers, it's a 7-day requirement that you have to stay away from work. And you can come back after 7 days.
That's good. I'm a big fan of the gadgets, so hopefully Steve will be back. All right.
Thank you, Steve. Dr. Nestor, thank you so much. We know that you're in the eye of the hurricane right now, so we appreciate you making time for this. Thank you very much.